As a man ages, his prostate gland continues to grow. Consequently, an enlarged prostate is as common to the aging process as, say, gray hair. 90% of men in their 70s and 80s have symptoms of BPH, or benign prostatic hyperplasia. But Chris Weber reports doctors at Grant Medical Center are using a revolutionary new laser to help ease those symptoms.
Like countless other middle-aged men, Ken Malpas suffered from the uncomfortable and unpleasant problems associated with enlarged prostate. And the medications he'd been taking for a couple of years were no longer providing satisfactory relief.
Trouble urinating, emptying my bladder, and that's what precipitated my general practitioner to recommend me to a urologist.
A few weeks ago, Ken became one of the first patients in Central Ohio to experience a new procedure that utilizes an advanced laser to open up the interior of the prostate, taking pressure off the urethra and allowing for a more comfortable flow. This new procedure is actually an improvement over what has been a time-honored method of treating BPH.
It is a procedure that we've used for 50 years, and the technique that we're using now is improving upon the older procedure called the transurethral resection of the prostate, a TURP, most commonly known as the Roto-Rooter job.
But instead of cutting away the prostate tissue immediately surrounding the urethra, the laser vaporizes the tissue. In fact, it's called a PVP laser, for photoselective vaporization of the prostate.
By evaporating the tissue, you just get less swelling, less damage to the other parts of the prostate that you're not removing. There's less bleeding because you're not cutting through blood vessels, you're evaporating them. I think eventually, as the technique improves with the laser, it will be a catheterless procedure. It'll be a bloodless and catheterless procedure, which, again, the benefits as opposed to the older way to do it are really quite remarkable.
It was very easy. I went into the hospital one afternoon. I think the procedure itself only lasted about 30 minutes or 40 minutes. I was in recovery for an hour and a half or so, and then was on my way home the same evening. So it wasn't difficult at all.
So far, patients who've been treated with the PVP laser report little or no side effects. Grant Medical Center was the first and is still the only hospital in Central Ohio currently offering this procedure.